first started to work in the field of alcoholic liver disease, the thing that intrigued me most was that it didn't seem to matter how much people drank or for how long, only about 20% of them ever ended up developing cirrhosis of the liver. And this was something that, as a young researcher, really caught my imagination. And for many years, I just simply collected blood samples from patients, not knowing what I was going to do with them eventually, but having a feeling it might be important in years to come. So lots of my research was centered around this main theme. I looked at the differences between men and women. I looked at the differences between ethnic groups, but I still wasn't getting the answer. And then we moved into the era of genetics, and I just wondered about whether those stored samples were going to be of any value to me. And eventually took up the genetic studies, and finally came up with a set of genes that look as though they indicate those individuals at highest risk for developing cirrhosis. But it didn't stop there, because now we're realizing that everything that happens to patients with cirrhosis probably does have some form of genetics underlying it. So at this meeting, we're thrilled to be able to produce some work on the genetics of the complication of hepatic encephalopathy, showing that people who have developed cirrhosis can actually be flagged as those that may go on to develop this particular complication. We've also expanded our original work so that we know not only the genes that actually predispose to the risk of developing cirrhosis and the development of the complications, but the ultimate outcome for those patients in terms of their survival. So I think in years to come, in Amsterdam next year even, we may already begin to see much more work in this field. Instead of just being the odd papers in the odd sessions, I think we're going to start seeing major sessions on the genetics of liver disease in general. I hope people are becoming more interested in the role of malnutrition in determining chronic liver disease. Nutrition and the nutritional aspects of liver disease have been such a Cinderella area. It's been an area of my interest for many, many years, pointing out that if you're malnourished, you are not going to do well. The difficulty has been, however, that we don't really seem to have the tools to determine which individuals are malnourished and which are not, which are at risk and which are not. The difficulty with liver disease is that often people retain fluid, so they look as though they're actually normally nourished or even overnourished. But underneath that fluid, there's significant reduction in muscle, and muscle is the key compartment in determining how a body functions. So there has been, with the advent of fairly fancy X-ray techniques, a renewed interest in this area. But none of that is applicable in clinical practice, and we still need the tools for someone to be able to stand at a bedside and determine whether someone is at risk. And hopefully our work in this area, which we have presented here before and will be presenting in the autumn at a European nutritional meeting, is going some way to identify how any clinician can spot these people and then potentially intervene. I think what's nice to see for a participant in the EASL meeting is that we are seeing rather less viral sessions than we are used to. In part, this is because, of course, we're becoming so good at treating viral hepatitis that it's not such an issue as it used to be, although it is, of course, in the developing world. So there is a resurgence of interest in the other aspects of liver disease in general. And so the big general sessions on cirrhosis per se, I am very much looking forward to. I mean, the other and most important aspect of EASL for me, of course, is the networking. This is the chance where you get to see those colleagues that you meant to ask a question, but you never got round to sending the email. And the other very exciting aspect for me, because of my interest in teaching and mentoring, will be the poster sessions with the Young Investigators. So it's a big thing for a young investigator to stand next to their first poster. And so it's really nice for them if someone does go along and show interest. So heavy attendance at the poster sessions for me, and hopefully some networking over coffee, if not something a bit stronger. The mentoring program that EASL started in 2013 is a very important aspect of its educational activities. So the principle is that, I was going to say older, but I'm going to use experience. A more experienced and knowledgeable hepatologist almost takes under their wing a young scientist or physician in the early but fairly critical phase of their development. So we normally look for people under the age of 35 who are EASL members who appear to be committed to a career in hepatology. So the mentee and the mentor form a relationship, and that's what's key. It's a very personal relationship between the two. And they look at all aspects of their work, their career, and their future. The EASL program allows very generously for the mentee to spend up to 2 weeks in the mentor's home laboratory, either learning new techniques, looking at data that can be published, designing studies, and of course they both come back and report at the Young Investigators Forum at the next EASL meeting. What has surprised me is that I thought when I was asked to be a mentor that I would receive as a mentee somewhere from Slovakia or the Ukraine, somewhere where in my mind I perceived they perhaps didn't have the same facilities as we had. But my mentee is from Denmark. And so when she was first appointed, I thought, well, I'm sure there wouldn't be much I could help with there. But it has been such a surprise. Denmark has all the facilities that you could want, but what it doesn't have are patients. It's a small country. It has a limited number of individuals with chronic liver disease. And that brings up its own problems, which are very, very different to the problems you might have somewhere less developed. And I think that there are lots of things that we are going to be able to do working within those exigencies, and actually developing for my mentee means to deal with that and get around it. I think the main benefit for a mentee is to have someone independently appraise where they are, what they're doing, and how that can be enhanced. I think as a mentor, you have to be very sensitive to the fact that your mentee will have perfectly reasonable and perfectly good mentors of their own in their own department. And for me, it is very important that I also work with those. I can't go, with grandiose plans saying, oh, she should do this and she should do this, if it is not within the sort of plans of the department itself. So I think that you go in with a fresh eye and have a look at what can be done, and what can be done in their own home institution, in their own home country. So I think it's the independent review of what they're doing, but very much within the whole aspects of what has been decided for them with their own bosses. I was invited to be a mentor by the Education Committee at EASL. It was a surprise. It came out of the blue. And when I read about the programme, because they sent me lots of internal detail, I just thought it was going to be a delightful opportunity. I'm very into teaching and mentoring. It's one of the things that's been, for me, the highlight of my career. And so to be able to extend that to someone outside of my own domain, I just thought it was a marvellous opportunity. The mentor-mentee match is made by EASL. So I was able to put in what my areas of interest were, but the selection procedure was down to EASL. And I must congratulate them because they've done very well with selecting a mentee for me. I've been around long enough to remember EASL when it was very small, and have watched it grow over the years. EASL was for a long, long time very much the small sister of the big American meeting. So you'd go to EASL to present your work, but if you got to ASLD, that was something very different. That role has been now completely reversed. And I think it's because EASL has been much more egalitarian than the American Association. It's accepted work from all over the world for presentation at its meetings. It's always very fairly assessed. It hasn't given preference, for example, to work coming from its European members. And it has grown in a way that has been sensible and pragmatic, encompassing as much as it can of all aspects of liver disease. And so now I would say without any question, EASL is the international liver meeting. It is bigger, it is better. And I think now it's the one that you would give preference to in terms of attendance.